Hi everyone, this is Chapter 12, Feminist Therapy Part 2 for Counseling 4500. All right, the feminist perspective on personality development. Societal gender role expectations profoundly influence a person's identity from the moment of birth and become deeply ingrained in adult personality. So, what that is basically saying is that we are expected to behave in a certain way from the moment that we are born. Imagine just when, a parent hears that they're going to have a girl or a boy. If it's a girl, sometimes they'll start to make things very feminine, very floral. Whereas with a boy, they might paint their bedroom blue or get blue sheets or blue clothes or clothes with trains on it. So it is very ingrained into our lives how we are supposed to behave, what we're supposed to play with, who we're supposed to play with, and all that other stuff. This generates a false sense of self and forces women to accept stereotyped gender roles such as being a lady, never swearing, never hitting, never getting angry, always striving to please men, and never to be better than a man, right? So, even if you look at this photo right here, the one on the left, the person sitting with her legs closed, is probably going to be seen as more respectable than a person with her legs kind of spread open a little bit, right? Although that's kind of unfair that women have to sit in a specific way or behave in a specific way. But that is how society has kind of expected it. But again, millennials, Gen Z, you all have started to challenge a lot of these things. Obviously, previous generations have too. But with social media, you're able to really show it out, publicly and everything like that. Most models of human growth and development emphasize a struggle towards independence and autonomy. So autonomy is being able to do things on your own, right? Feminists see relational qualities as strengths and pathways for healthy growth and development. So here we're talking about growing up and then actually trying to be who you are authentically. Relational cultural theory is the vital role that relationships and connectedness with others. So to believe that we all are actually helping each other in this world, we connect with each other in this world because we're not typically alone, right? Gender schemas. Okay, schema is just a fancy word for a map or a blueprint. Okay, so when you say gender schema, it's kind of like a map of what it means to be a boy or a girl. So children develop these gender schemas, internalizations of the gender roles perpetuated in a sexist society. So, for example, a boy might grow up a boy might be a kid and then be asked, "Hey, what do you want to do when you grow up?" And he's gonna say, "I'm gonna be a firefighter. I'm gonna be a doctor. I'm gonna be a lawyer." Right? Whereas girls, they might say something like, "Oh, I want to be a wife. I want to be a mother, and I want to be maybe a teacher or a nurse, but not a doctor because doctors are more men oriented." Obviously, some of the stuff that I'm saying to you as millennials and Gen Z, you might go, "Wait a minute, that's not how I was raised." Yeah, thankfully, these stereotypes or these constructs that we're talking about are slowly being torn down by your parents potentially, right? Gendered lies, the belief that gender is an organizing principle in people's lives. So what that is saying is that, gender does kind of dictate how we behave. All right. The masculine defines the feminine. For example, men pay great attention to women's bodies, so women's appearance is given tremendous importance in society. Therefore, eating disorders and depression are then common. So again, we're bringing back that male gaze idea, which is that men define how women should look like or exist in society. Barbara Cougar, I just want to introduce you to a really famous feminist artist. Her name was Barbara Cougar, 1989. This Your Body is a Battleground. She is well known for finding found images and then putting words on it and then kind of talking about feminism and how about women and stereotypes and oppression. You'll probably go, this looks kind of familiar, like a Supreme t-shirt. Yeah, because Supreme stole her look, and they've even actually said, yeah, we totally took her look. And back then I don't think she thought that Supreme was going to be really big, so she's like, whatever. But actually they totally took her graphic design style and used it. So I just wanted to introduce you to a really well-known, there are many, many feminist painters and artists and stuff like that, but for sure, I think she's one of the most respectable ones. If you go to Little Tokyo in LA, on the side of the Mocha Geffen, there's a huge thing, a huge painted sign thing that you'll see on the side of the building. I think it's still there. It should still be there. That is about, oppression and racism and feminism and stuff like that as well. All right, let's talk about principles of feminist therapy. The personal is political. So kind of similar to what we just talked about when it comes to that Barbara Kruger paint or illustration, graphic design. Personal problems that people bring to counseling originate in a political and social context. So when women come into therapy, oftentimes they're upset, not about something that they themselves are, but about how they're not able to match up to the expectations of society. They're marginalized, which basically means pushed to the side like a margin of a paper, oppression, subordination, and then stereotyping as well. We want to also talk about commitment to social change. So when a client comes in, they're not just helping themselves, they're going to also help society by breaking down these stereotypes and stuff like that, right? So making social change. So aims for social change as well as in individual change. Advance a different vision of society organization that frees both men and women from gender role expectations. Move from change from within to a realm of social activism. So feminism is talking about helping society. You don't want to just help yourself as one person. Why not also help everyone around us so that the future generations don't have to go through the things that you had gone through as a man or as a woman? Women and girls' voices and ways of knowing are valued and their experiences are honored. Replace patriarchal, remember that means male dominated or male run, objective truth with feminist consciousness so that there's more of a diverse way of seeing the world. Value their emotions and their intuition and to use their personal experience as a touchstone for determining what is reality. The counseling relationship is egalitarian. Recognize that there is a power imbalance in the therapeutic relationship. Keep in mind that clients are the experts in their own lives. So when it comes to this, which is something that I always tell my students when I'm teaching them about individual and group counseling, is that let's say if you are a male therapist and you have a female client, you should just bring that up and say, are you sure you're comfortable? Or you can not say, are you sure? But you can say, are you comfortable that I am a male therapist with you? If you're uncomfortable with that because of the power dynamic, I can recommend you or refer you to a female therapist, right? And that is not necessarily because we don't think that we're good enough as a male therapist. It's about letting them know that there is a difference between us two, right? And when a client knows that you're willing to address and notice these things, they appreciate it because they're saying, oh, you're being considerate of who I am and if I'm comfortable or not. Or, the same thing with, let's say, if you are if you're a white therapist and you have a black client, right? I would bring that up. I just want to make sure that you're comfortable with the fact that I am a white therapist and you're a black client. Would you prefer to have, let's say, a black therapist instead? Usually the clients will probably say that's fine. But by bringing it up, you kind of address the fact that there are these things that exist in society that we were raised to see and believe in. And we want to just address those things. And it shows consideration to your client. All right, a focus of strength and a reformulated definition of psychological distress, troubled relationship with diagnostic labeling. So as you can see already in feminism, they don't really like these labels because psychological distress is reframed not as a disease, but as a communication about unjust systems. So it's really about society, right? When the contextual variables are considered, symptoms may be reframed as survival strategies. So when we understand the situation, that's what the context is like, what's going on at this moment. Actually, the reason why you are yelling or you're screaming, you're angry or whatever, is actually you are trying to survive the society that is putting all these things on you that you don't think that it needs to be put on you, right? So you're surviving. You're doing those things because you're trying to live, right? All right. All types of oppression are recognized. Acknowledge that social and political inequalities have a negative effect on all people. Diverse sources of oppression, not just gender, are identified and interactively explored as a basis for understanding the concerns that clients bring to therapy. So again, we're bringing back into this whole thing intersectionality, right? It's all these different components. Being a lesbian, being Latina, having a disability, all those things are going to make you who you are, and there are multiple sources of oppression and unjust systems because of one or more of those things. Framing clients' problems with a cultural context leads to empowerment. So then they now realize it's not you, it's actually society and stuff like that is making this all awful. So you feel a little bit better as a client or as a person. Oh, okay, it's not me. I'm just putting all these things because I was raised because of the society that I'm living in. All right, let's talk about therapeutic process and therapeutic goals. Empowerment, okay? So one major one is to empower you as a client, as a woman, or as a person of color. Valuing and affirming your diversity. Striving for change rather than adjustment. So you're actually trying to change society, change everything, instead of just going, I'm going to try to list, how do I live in this world? Instead, you're like, no, this is how, I want to live. And I don't think that I need to be that person that you're expecting me to be just because of, let's say, my gender. Equality, balancing independence and interdependence. So being able to understand that sometimes you do need other people to lift yourself up. Other times you can do it on your own. Social change and self-nurturance. So taking care of yourself. Active agents on their own behalf and on the behalf of others. So again, community. Create the kind of society where sexism and other forms of discrimination and oppression are no longer a reality. Obviously, that's going to take a lot longer, but we try every day, and then we add a little bit more to it, hopefully, for society. So maybe Gen Alpha, maybe Gen M, whatever M is, might be a little bit better off than we are today. Here's a huge other list. I'm not going to read all of this stuff, so I'll just read a couple. I'll read the ones that are highlighted in blue. Identify their internalized message and replace them with more self-enhancing beliefs. Acquire skills to bring about change in the environment, so learning how to change. Develop a wide range of behaviors that are freely chosen. Develop a sense of power and social power, personal power and social power, and then also trust their own experiences and their intuition. And there's also more, so I just want you to read the rest of it on your own. All right, let's talk about the application techniques, therapeutic techniques and procedures. The role of assessment and diagnosis. We talked about this earlier a little bit, but let's keep on going into this. Sharply critical of the DSM classification system because gender, culture, and race may influence assessments of client symptoms. So again, we talk about the fact that society sometimes are the reasons why people feel bad, not themselves. So you want to ask this question, who benefits from using this label? How might this label contribute to disempowering the person to whom it is assigned? Right? And think about that, when someone gets the sign that they're depressed, it kind of blames that person. Now that person has to get out of it on their own. Whereas if the depression is caused because of societal expectations, we need to just get rid of those things and then there won't necessarily be depression, right? All right, some limiting reasons here. I'll read a couple of them. Number one, they focus on the person's symptoms and not the social factors that can cause dysfunctional behavior. Number three is that the personality disorders especially may reinforce gender role stereotypes and encourage adjustment to the norms of the status quo. Women are often much more diagnosed with depression than men. Okay. 5, they can lead to an overemphasis on individual solutions rather than in social change. Oh, by the way, men usually don't talk about their feelings, right? So then that becomes an issue too. Why can't men talk about their feelings? Why can't men cry, right? Because it's seen in a certain way out in public. And that's something that we want to question as well. It's not just necessarily just women, but also men also have very, very difficult expectations that they also have to kind of bring to the table as well in the world. And it's very stressful because not all men want to do those things or feel that they need to, but they do because of the expectations of society. All right, the DSM talks about depression as being diagnosed twice as often for women than men. Women obviously have more reasons to be depressed. So let's talk a little bit about those contexts where women become depressed. More often, they are financially disadvantaged or dependent, which basically means that they're often not educated enough to go to work and make enough money to take care of themselves. Relationally submissive, strive to please others by anticipating their needs. So they always have to expect to help other people all the time. Domestic violence, sexual abuse, poverty, sexual harassment in the workplace, and also eating disorders from the messages that are given by society or mass media. So if you look at all these contexts where women are depressed, we realize, oh, it's not necessarily them. It's because society puts all these expectations on them that are kind of unnecessary, right? So this is the reason why they can be diagnosed twice as much with depression than men. Borderline personality disorder. This is hyperlinked so that you have a definition of what borderline personality disorder is. This is not an abnormal psych class, so I'm not going to go very much into it. But it does talk about the fact that oftentimes there's a lack of control of their impulses. Okay, but please go and look on the website for the full definition of that. Okay, women who are diagnosed with borderline personality disorder often have escaped physical abuse or sexual molestation. So this is a complex type of post-traumatic stress disorder, or CPTSD, which is considered a more compassionate, kinder diagnosis than the other one. So the reason why is we want to understand that sometimes people scream, yell, become violent even. Part of that is because they're trying to survive, okay, from all the trauma that they are experiencing. So, and complex post-traumatic stress disorder basically means that's repeated over and over again. Let's say that you get robbed at a supermarket. That might probably happen once in your life. But if you're being abused every day, that would be considered complex post-traumatic stress disorder because it's happening all the time. Okay. And so that means that it affects you in your survival modes very differently. All right. Techniques and strategies. Goals of empowering clients while evoking feminist consciousness. Refer to Alma on page 375 in the textbook. And what that is just a vignette about a person who is a lesbian, and she is trying to fit in at work, but she wants to have short hair, but society thinks that long hair is more appropriate. She doesn't want to wear dresses, and yet she feels that she has to. So it's talking about being able to fit in, right? So being able to read that vignette and having a dialogue would be really fantastic. So it talks about empowerment in that sense. So it enables people to see themselves as active agents on behalf of themselves and others. Informed consent is really incredible, empowering for some people because sometimes women are never ever asked about what they're thinking or how they feel about anything. So when you come into therapy and you give them informed consent, you're letting them know exactly what's happening. They're like, wow, okay, I know exactly what's going on now. As opposed to before, they're like, I don't know, and I'm a little scared, but I'll just go along because this is how I've always been told to do it, right? To accept things, and that's it. Egalitarian and collaborative. You want to demystify, which means do not make it mysterious or unknown. So you want to make it clear for everyone to know what's going on so that they can take charge of direction, length, and procedures of the therapy. Interrupt the trance of powerlessness. What is the most powerful thing you can do right now, right? And I've even been told by some instructors, when you bring a client into an office to do your therapy, by just going, hey, which chair would you like to sit in? That's something that some women have never been even able to choose where to sit. They've always been told, right? And so that can be very, very empowering for a person. Okay, self-disclosure. Equalize the client-therapist relationship. So sometimes you do want to talk about your own personal experience as a therapist and as a woman, let's say, or your experiences of gender discrimination or differences or acknowledgement of that if you're a male therapist, right? So that, again, it's out in the air, it's out in the open, so that the client can then decide what to do next. And usually they will appreciate that. All right, you can also provide modeling to normalize women's collective experiences. If you're a woman therapist, by letting your client know that you have also experienced some of those things, then, now there's a connection between you two because there's a shared commonality. To empower the clients and to establish informed consent. In terms of privacy, a therapist may disclose how she balances a private life and public life that works for her and not against her. So again, modeling, because again, some women have never seen how it is to have, let's say, a life where they are in charge of everything. Keeps the therapist present, so that means that you're going to be there also just because you're being active and talking about both of your experiences. And therapist states their values and beliefs about society as well. And you might want to explain some of those concepts that we were talking about, how we do live in a patriarchy, and how do we, change the patriarchy, try to, neutralize it so that's both nurturing as well, and other things as well. Yeah. All right, gender role analysis. Explore the gender role expectations of the client's psychological well-being and draws upon this information to make decisions about future gender role behaviors. So we're talking about gender now, right? And the expectations. And you can use the word addressing, which spells what you're going to see this list right here. If you look down, that spells addressing. So you're talking about age, developmental disabilities that are acquired. That means that you get it like in an accident or something like that. Religion, ethnicity, socioeconomic status. That means, did you live in wealth or did you live in poverty? Were you middle class? Sexual orientation, indigenous heritage, national origin, and gender. So these are areas that we can talk about so that we understand the intersectionalities of each person, so that we understand that we're all very unique people. Gender role intervention, placing concerns in the context of society's roles, expectations for the women, provide insight into the ways social issues are affecting the client, and then explore how a client's refusal to conform may make this personal a role model for others in society. So here we're talking and explaining what's going on in society, and then also saying, hey, you can change it, you can stand up to it, and how this then becomes a model for the next person who that person may meet, or that you may have as a client, to be able to share those things and learn from each other, and then be one less person who's not going to do these things, these gender expectations. All right, power analysis, helping clients understand how unequal access to power and resources can influence personal realities. So just when you know that you are being discriminated against, your reality of being able to get certain things changes than a person who's never had to experience those things, right? Explore how inequities or institutional barriers often limit self-definition and well-being. So again, society will dictate certain things about you or expect certain things about you, and you want to be able to change those things. Differences in power between men and women, sexual orientation as well. Learn to appreciate herself as is, regain self-confidence, setting goals that will be fulfilled with the cultural values. So again, understanding that there's all a power around society that is forcing the woman to behave in a certain way, that society is expecting, and to be able to challenge those ideas. You can also use bibliotherapy in feminist therapy. So you can look at nonfiction books, which are not fake books, NF, that's how I remember it. So these are biographies about real people, right? Psychology and counseling textbook that talks to explain about, how there are expectations on people through lifespan, through growing up and all that stuff. Autobiographies, so those are written by real people. Self-help books, educational videos, and films. And obviously bibliotherapy means book, but we're going to include film into this as well. And oftentimes with these books or these movies, we're focusing on incest, rape, being battered, and sexual harassment, which are oftentimes very common with women. Assertiveness training. So there's a difference between assertive and aggressive, okay? Assertive basically means being able to state what you want, but being respectful to the other person that you're talking to, okay? So could you please pass the book to me, right? That would be considered assertive because that's what you want. You're stating it, but you're still respecting the other person. Aggressive is give me that book. Okay, I hope you understand the difference between those two. And so we want to change that aggressiveness into assertiveness. But most of the time when we're talking about women, oftentimes they're not assertive at all. They're yes people who are told to say yes to everything, never to say no, right? Or never to speak up. And we're talking about is helping those people become much more assertive in their lives. So make women become more aware of their interpersonal rights, which means when you talk to other people, transcend stereotypical gender roles, change their negative beliefs, and implement changes in their daily lives. Because of this, you want to increase in power to reduce depression and anxiety because they're speaking up. Okay. Reframing and relabeling. Okay, so reframing means shift from blaming the victim to a consideration of social factors in the environment that contribute to a client's problem. So, right, remember we talked about this before. Instead of blaming the person, we're blaming society for the expectations that are considered, not reasonable. Depression and anxiety are linked to social pressures to behave within heteronormative gender role expectations and to develop an appearance that matches these culturally and societally prescribed ideas. I don't know if you've ever heard of internalized hatred or internalized, let's say, homophobia, which are basically people who are gay, but they hate themselves. And the reason why is because society says that gays are bad. And so then they go, oh yeah, gays are bad. Oh, wait a minute, I am gay. Now, oh no, I hate myself, potentially, right? So we're reframing this so that it's no longer a bad thing. Okay, being gay is being authentic to myself. It doesn't hurt anyone else, right? And you want to respect your own self first. All right, relabeling, changing the label applied to some behavioral characteristics. So feeling of being unwanted because the client does not conform to ideals commonly associated with feminism. Okay, so you want to change it. So instead of saying, this person's ugly, this person is great. This person's a person, and that's it, right? We don't want to add those negative ideas into it. And we oftentimes see it right now with body positivity, where we're accepting everything, right? No matter what that person looks like. All right, social action. As a client understands the groundwork for feminism, they might be encouraged to volunteer in rape crisis centers, lobbying lawmakers, providing community education about gender issues as well. You're going to help connect their feelings with socio-political context. So here, that social action, that activism part that we're talking about, to change society one at a time, right? So if you work at a center, you're helping other people that you've already now gone through it yourself as well, or you're in the process of learning about yourself, and you're also helping other people as well. Group work is consciousness-raising groups provided a way for women to share their experiences of oppression and powerlessness. Evolved into self-help groups that empowered women and challenged many of the social patterns of the time. So again, working in groups as opposed to individual, similar things. The role of men in feminist therapy. So can men be feminist therapists? Absolutely, because we're talking about is, giving an opportunity for men and women to have the same things to do, or same things to have, same opportunities. Feminist therapy can be used with male clients as well, because if you think about it, there are some men who are very, very controlling, right? In abusive relationships. And part of that might be because of the way society is expecting them to be. If they're not allowed to express their feelings, they keep it all bottled up. And sometimes all of that stress comes out in violence, right? And so let's teach them about the fact that they don't have to do those things. That those male expectations are just social constructs that can be destroyed, so that they can have an argument with another person, but in a mature, safe way as opposed to a violent way. Okay? Male feminist therapists willing to understand and own their male privilege. So if you are a man, you need to recognize that you do have more power than a woman, right? Just because you are a man, so this is not your fault, right? But if you go in the world, let's say if you were a man and you stood next to a woman, right? You're just walking along with each other, and then someone comes up. Usually they'll ask the man for help as opposed to the woman for help. So already right there, there's a lot of differences right there. And that's what we're talking about. That's just one example. Confront sexist behavior in themselves and others. So how have you also been part of this whole thing where you thought, why can't he be man enough to, do certain things or whatever, right? So, like fix a tire or something like that. Why is he like a girl? Like, why can't he just fix his own car? So these are things that can be potentially very traumatic for certain people. All right, redefine masculinity and femininity according to other traditional values. So instead of those things, you want to focus on other contributions that men and women can offer each other. Work towards establishing egalitarian relationships and actively support women's efforts to create a just society. Feminist therapists work with men, usually abusive and batterers group. You'll see anger management, oftentimes something that is really considered part of that feminist therapy area, right? For men, it would be anger management or aggression. Learn how to increase their capacity for intimacy. So that means being able to be vulnerable with each other or with loved ones. Express their emotions and learning self-disclosure. Balancing achievement and relationship needs. Accepting their vulnerabilities. Creating collaborative relationships at work with partners that are not based on power over model of relating. So, feminist therapy from a multicultural and social justice perspective, the strength is that most common with multicultural and social justice perspectives are the social, political, environmental changes. Because every society does have these expectations. So we're trying to address those things, right? Bring it up and talk about those things so that we're all aware that society has these things that are expected of us, but it doesn't necessarily mean that we need to do those things or follow those things. Shortcomings are that some women do not share the belief that do not advocate for change in the social structure, and if the counselor believes are too strong and cause internal conflict with the client. So let's address that really quickly here. Some women do not share the belief that do not advocate for change in social structure. So there are women who like to be women in the cliche stereotypical way. So they're not necessarily going to like feminist therapy, right? And that's totally fine. But that can be challenging because you're not trying to change women in how they behave if they're not unhappy. Or if they're not happy, I'm sorry. Or no, if they're not unhappy. If they're happy the way they are, then that's good. But that can be a shortcoming for this. And also, as you heard already, there's a lot of terminology in feminist therapy or gender studies or queer studies. So sometimes when you talk in this language, it becomes a little overwhelming. And then people are like, whoa, this is just too much. There's too many changes that you're expecting me to do. You know, this is how I was raised and this is how I think the world should be. So again, that can be very challenging for some people to understand. And so, yeah, that would not necessarily work for someone who is like that. All right, this is the end of the chapter. Thank you. Goodbye.